Good morning, everyone, and thank you for having me today. My name is Hannah Bates, and today I will be talking to you about the importance of missions, and especially when it comes to medical missions. So the objectives of this presentation are to inform you on why international service programs are important, give examples of problems and organizations that focus on these problems, and inspire you to go out and volunteer internationally. So first, who here volunteers at Big Event or Relay for Life? Good. And does anyone volunteer outside of those here in Blacksburg? How about anyone who's gone on a mission trip? Okay, well, I hope that this presentation inspires you to do so. As I've gotten older and gone through more schooling, I've realized how much a great deal of countries don't have the same educational and medical opportunities that we have here in the United States. A big reason for this is due to extreme poverty and lack of opportunities that many of us take for granted. According to the World Bank, Central Africa has an extremely high poverty level. And you can see that here in this map. So you can see right here, it shows that the share of population living on less than $1.25 a day. And the darker purple is that, and then the lighter the purple gets, the more they live on. So there tends to be a vicious cycle when it comes to poverty and disabilities. And you can see that here. So disability leads to limited access in healthcare and education and employment, which leads to poverty, which leads to unsafe living and working conditions, and limited access to healthcare, which leads back to disability, and so on and so forth. So this cycle shows how poverty and disabilities really go hand in hand, but not only do these factors influence each other, but they also influence literacy levels in developing countries. Now, if you could look at the maps that I handed out, there's one for poverty and one for adult literacy, and if you could think about how they relate to each other, and if you want to talk to people around you. Bless you. So does anyone have any comments on how they relate to each other?
I guess if there's high poverty, then there's probably low education access.
Yeah.
So
if there's not educational opportunities, then there's going to be less opportunities for them to get higher paying jobs, which leads to poverty, and disability can lead to a lack of education, so they all really intertwine and connect with each other. So the disabled population in developing countries is continuously increasing, and without the educational and medical and material opportunities, they're unable to treat and properly care for these people. According to PCHAC, the World Health Organization estimates that over 650 million people live with disabilities worldwide. This is 1 in 10 people in the world's population. 80% of these people live in developing countries with inadequate access to health and rehabilitation services, and that's where we come in. Without volunteers, these countries will continue to have disabled people who will likely never receive treatment. These disabilities can range from visual impairments to deformities to disease, all of which can greatly affect their quality of life and ability to work. it comes to visual impairments, Eyesight International states that more than 180 people in the developing world, 180 million people in the developing world are visually impaired. 45 million of these people are completely blind, and unless urgent care is taken, this number is expected to increase to 75 million people by 2020. Infection, malnutrition, and lack of eye care results in blindness rates 10 to 40 times greater in developing countries than in developed countries. 4 out of 5 blind people in developing countries have conditions such as nearsightedness, farsightedness, astigmatism, and cataracts, which all have treatments that are widely available in the developed world, and they're at a moderate cost to get these treatments done. So that's where Eyesight International comes in. So Eyesight International states that their approach is to help developing countries build resources and skills so that they can provide quality eye care over the long term. They believe that effective long-term solutions to blindness and visual impairment can only be found in locally sustainable programs, staffed and supported by the communities that they serve. Improving someone's vision can greatly improve their quality of life. Having a visual impairment can greatly hinder someone's education and job opportunities. So a serious congenital deformity is clubfoot, which is shown here. And you can see the downward and inward twist of the feet. And this obviously makes walking kind of hard to impossible. According to Cure Clubfoot, even though 1 out of 750 children born worldwide suffer from this deformity, the developing world bears 90% of the disease burden. This is because developing countries allocate less than 10% to healthcare costs, even though clubfoot is a curable condition if it's treated and it's inexpensive. A child born with clubfoot in a developing country has little chance of being productive, contributing adult if they do not receive treatment. In the majority of the cases, children under 2 can have a clubfoot corrected with non-surgical intervention that results in minor scarring, an unhindered bone development, and mobile, pain-free, flexible feet. The most widely utilized treatment procedure is the Ponseti method, which is shown here. So basically they take casts and eventually, in increments, stretch out the tendons and ligaments to get them into the correct place. Usually the cast is on for a week, and then they take it off, put another one on, so that it keeps them stretching it. Eventually it gets back to where they should be, and then they're completely fine and can walk. So this method is a method of manipulation to stretch contracted ligaments. Tenotomy, which is a surgical cutting of a tendon with local anesthesia, bracing, and follow-up visits. The Global Clubfoot Initiative is an umbrella organization for nonprofits dedicated to treating clubfoot in developing countries. They describe themselves as a consortium of individuals and organizations with technical and organizational expertise in clubfoot management, using the Ponseti method and experience in establishing national clubfoot programs in low and middle income countries. This initiative brings together and strengthens the work for organizations around the world involved in prevention of disabilities caused by untreated clubfoot. If clubfoot goes untreated, they're likely to not get jobs, not really be able to do anything, or they're going to try to walk and it's going to get worse and it can get severely infected, which can lead to amputation. So obviously it's pretty hard to walk around on the feet if it's not treated, as you could see from the picture before. So many of us take walking for granted, but what if you never knew what it was like to walk normally, even though your condition could have been treated? There are many diseases around the world. Some you can currently treat and cure, others you can't. One disease that can, however, is polio. Polio is a crippling and potentially deadly infectious disease caused by the polio virus, which spreads from person to person and can invade an infected person's brain and spinal cord. Symptoms can range from no visible symptoms to flu-like symptoms to more serious symptoms such as feeling pins and needles in the legs, an infection of the covering of the spinal cord and or brain, and paralysis or weakness in arms, legs, or both. Although polio can potentially be deadly, there are vaccines for preventing the spread. Rotary International's End Polio Now program is zeroing in on the polio virus. It's been over 3 years since they've seen type 3 wild polio in the world, which means that this particular strain has most likely disappeared forever. Although things are looking up, it was only in late October of 2015 that Nigeria was formally removed from the list of polio-endemic countries, making the entire African continent free of this crippling disease. The first successful polio vaccine was created in 1953, yet it took another 62 years to eradicate the disease from the continent of Africa. And they only did this through the volunteer work of people going over there and distributing vaccines to children. Now that you see some of the health problems that people in developing countries face, I hope you're inspired to help in any way you can. The problem doesn't end with the 3 examples in my presentation. There are hundreds of other issues that you can lessen and organizations dedicated to service that you can get involved with. Whether you start now by joining Students Helping Honduras or joining the Peace Corps in 20 years, get out there and help. We go through all this schooling anyways, we might as well go to these countries that don't have these opportunities for the education and help them out. I really hope my presentation enlightened you of the difficulties in developing countries and inspire you to do something about it. Are there any questions?